Hi, welcome to Well Rounded Momma's YouTube channel. If you find this video helpful, like, subscribe.
Ring the bell. Where's my bell?
What was this?
I don't know. I feel like she's
That was like a very cheer.
put the...
So my name is Sherry. This is Tori. We are both midwives at Well Rounded Momma, serving the Las Vegas area. And this is Lexi. She has a few hats that she wears down here. She is a doula. She helps run the front desk, and she is a new student midwife. So we asked her to join us. Her last baby was born at home.
Yeah, giant
He was big.
baby, 10.2 pounds at home.
He walked out of her.
Oh.
Today we want to talk about due dates. What are due dates? How do we come up with due dates? Why are they important? How do they work in a physician's office versus how do they affect you when you're hiring a midwife? Tori. When somebody gets pregnant, how do we come up with their due date?
So we use a wheel sometimes. This is our handy dandy cheating wheel. There are ways that you can count. Oh, I don't even remember this. It's count back 3 months and add a week.
Yeah. What's that called?
Nigel's. So we go by the first day of your missed period. First day of your missed period. Go back 3 months, add a week to get your due date. Or you can use this fancy wheel or an app. But that is based on if you ovulate exactly 2 weeks from your first day of your last missed period. That can be off. If you don't ovulate exactly 14 days later, could change your due date. Some people go by their conception date.
So we used your
Somebody
last
came up
menstrual
with this.
period. And so that is what an LMP is. It'll be all through your chart. Nobody knows what to do with you without one. If you
They really
call to
don't.
do labs, if you talk to
many
your
weeks
insurance
are
company,
you?
if you go to schedule an ultrasound, your LMP is like the plague. It's gonna follow you. That's the
period.
idea, is that you're gonna carry a baby for 40 weeks. That's the gestational. But like Tori said, there's a lot of kind of inconsistencies. If that works if you have a 28-day cycle, but what if you have a 30-day cycle or a 32-day cycle, or you have a 24-day cycle? So you'll see it called a few different things. Some paperwork I still get says EDC, which is your estimated date of confinement. Being pregnant, I'm not confined.
Oh, I
That's annoying to me.
It is very
The other one is EDD, which is estimated due date. And we have heard some individuals now calling it an estimated guess date, just to kind of lighten that a little bit, because there is this idea that
It's a guess.
it's just a guess.
Guess not.
I think nowadays, though, because ultrasound technology is used so much to determine
Everything.
due dates, size of baby, I think when you go in for your ultrasound, they are really throwing some serious accuracy. Here's the most important thing to remember, and this is in our ultrasound video. The closer you are to date of conception is the more accurate that due date is. But if you go in your 20 weeks, that's not a super accurate scan because you're so far from your date of conception.
Baby could have
But-
had a growth spurt. Well, and then it's like, you know, you obviously turn into a pumpkin at 40 weeks, and God help us if we don't induce you right away. And
Well, and I think that there's a few reasons why that happens. One is, for those of you who have ever had a baby before, when you get to the end of your pregnancy, it can potentially be rough. You probably want to be done at some point of your pregnancy.
what? No. I want to be pregnant for like a quadrillion years.
Now I'm like begging Tori.
I know.
That's
Please do something.
sarcasm.
I'm like, sorry.
And if you are like, hey, we could bring your baby, people are generally like,
sign me up.
heck yeah.
It's hard to be patient.
I think it's also difficult because we are so used to scheduling our lives. When it comes to like family members coming in town and helping, it's just really hard because it's not like you're going to go fly on standby and
Right.
show up and make the delivery. And so I think a lot of times that is hard.
But then you fall into this is why we have failed inductions. If your baby's really not ready and you're guessing that you're 40 weeks, but maybe you're more like 39 and your body doesn't want to do that yet, you're gonna potentially run the risk of a failed induction, potentially end up in a C-section if that fails. And so it is like a slippery slope, this idea of like using this hard set date.
We can torture individuals' bodies as much as possible, but if the baby doesn't want to be born, they're like, no. Here at Well Rounded Momma and most home birth practices, when do we start caring about individuals past your due date?
I mean, usually, again, because it's just a guesstimate, we do start doing like biophysical profiles when we think you're about 41 and a half weeks, just to make sure the baby's fluid level's good, their placenta's still functioning well, they're thriving, they're practice breathing, they're doing the things that they should be, and that they're still thriving in utero, that there's not a medical reason to kick your baby out. I feel like that's when we care.
Yeah.
And only 5% of women actually give birth on their due date. So more people should know that.
I think it's really hard for an individual to see a physician who puts this kind of pressure on somebody that you have no control over.
Yeah.
Especially when it's a VBAC and they're like, you have to go into labor by your due date or else
It's just an automatic
you have to have a
section.
C-section. And that's just frustrating because, baby.
You literally can't have no control over this.
Yeah, you're just
like,
stressing
okay.
yourself out over it. So
Which
then
then
you're
makes you
gonna
not go into
labor.
labor.
So it's
It's a vicious cycle.
And I like to think of it more as a guest month because then I have people asking, when are you due? And it's like, I'm due in October. And they're like, well, what date? I'm like, well, the date doesn't matter because the baby's going to come when he's ready.
So what I want to end on is let's talk a little bit about our own personal experiences, not with our midwifery practice, but with us having our babies. So talk to me a little bit about Tori has 2 kids. Talk to me about when they decided to come.
That's 4. I don't know why I put up 4 fingers.
I have 4.
She has 4. I'm like a weirdo and walk around very dilated in the end. So Riker did come a little bit early. He was 38 and 3 when I had him, and Charlie came on her due date, but probably would have came later if I didn't stand at Build-A-Bear for 12 hours the day before. So
It's true.
I did not go late with my kiddos.
Were you struggling towards the end of your pregnancy?
I was struggling more with Charlie because I went early with Riker.
Yeah.
So then I was like, what the hell? Get out of my body.
So did your babies come on time, Lexi?
Well, I had
She has a colorful
Yeah.
history.
C-sections,
We're gonna make
so
it
2
coloring.
C-sections, and then my VBAC, had to be medically induced, and there's only one doctor here that would actually allow that. So that was at 39 weeks, and then Sawyer, because I had never actually gone into labor on my own, so the anxiety was crazy. And even though I know I shouldn't do any medical interventions, I shouldn't get my membrane stripped, it's still so hard at the end to get yourself to just relax, my baby will come. But I was in so much pain. I feel better now knowing he was 10 pounds. That's such a big
Because Lexi's 90 pounds soaking wet.
Yes, that was horrible. I'm literally crawling across my loft, telling Tori, I'm done. I need this baby out. And thankfully, finally, when I just let go of, this is my due date, why isn't he here? I'm having all these contractions, but no active labor. And finally, I just gave up, relaxed, got some
It's always when you
rest,
give
and
up.
I'm like, he's gonna come
You're
soon.
defeated.
And I just let go mentally, and that's when I finally got to call Tori, or just ignore her phone calls.
Yeah, I called her a ton and was like, I'm really worried you're having a baby without me. Can you call me back?
Yeah, thank God she came, because 30 minutes later, a baby was born.
Yeah.
He was born literally 30 minutes before his due date, so.
I think the thing to remember is, yes, everybody is going to have an estimated due date given to their pregnancies, but kind of not being married to that day and having some forthright conversations with your care provider about what that due date means to them and what the protocols are and what they follow and how long that you can go past that, I think is important. And I think just knowing ahead of time, how are you going to mentally, when you hit that wall at the end of your pregnancy, what does that look like? Do you have support humans in your life that are going to talk you through that and be there for you? Sometimes people plan baby moons towards the end of their pregnancy, and they're really great distractions. So I think doing some kind of a distraction for yourself at the end of your pregnancy and planning that, right? That's the perfect time to decorate your nursery. Sometimes people put all this time in prior to that, but you know what? Waiting till the last month to do that is such a good project and distraction, and gets you excited for baby in a way without putting pressure on you. So there's a lot of different things that you can do, I think, ahead of time to prepare.
You can go stand at the mall for 12 plus hours.
Okay, to further explain upon that, Build-A-Bear, as a marketing ploy, told everybody they could come get
A Build-A-Bear.
a Build-A-Bear for free.
No, it was the age of your child. So Riker was 3, so it was $3 to get him a Build-A-Bear. So it was obviously worth
The
it.
line at our local mall, I can't believe you didn't see that and be like, yeah,
Well,
no.
they started coming around and be like, we actually only have enough to seat 300 kids. We're going to give everybody return vouchers. So I was like, well, let's just wait in line until we get our voucher. But me and Cora were $298, $297, and $296. So they were like, well, you're
right
stuck.
at that cusp.
You're right at that cusp. So I was like, we've already been in line for 4 hours. We're just doing this. And like everybody in line though was really funny. They were like, oh, when are you due? I was like, tomorrow.
So that was a project for her. That was a good distraction, and it took her mind off of being pregnant.
I gave up because I literally was like, Cora, we will go to Build-A-Bear if I don't have this baby tonight because she's never going to come, obviously, and I'm just going to be pregnant for all eternity. It worked.
So let us know what your story is down below. Did you go past that estimated due date? And if so, how did you keep yourself distracted in that last month? So thanks for joining us. If you find this video likeful.
You really like the word likeful.
I know.
Helpful.
Subscribe, ring the bell. We will see you next week.
Deuces.
Deuces.
This morning he goes, please, and I'm like, no. He goes, then I'm gonna pee my pants. And I'm like,
Well then.
okay,
Threaten Aunt Sherry's house.
I'm gonna.
I'm gonna drop this off. I'm taking Sherry. Riker would be like, okay. Riker likes going to your house. He likes you.
He's a little afraid of me though, I can tell.
I don't know.
A little bit, because he kind of sometimes looks at me like with hesitation.
But it's so funny because anytime I'm talking to you, he's like, who are you talking to? I'm like, Sherry. And he's like, oh, let me say hi. He like takes the phone.
But then he doesn't finish the conversation.
Like,
I was
okay,
totally
bye.
like asking him questions, and I'm like, Riker? Hey, you still there?
Well, sometimes I'll take the phone from him because sometimes he'll like leave with my phone and I'm like, come back.
Rewind.
Start again. Lexi's like, why the hell am I doing this?
All right, are we ready to start? You feel prepared? Remember what we're talking about? All right.
Due dates and how they're non-existent.